But there are young people in front of us right now, and they are dying, and we have a responsibility to provide them with the care that they deserve.
Hundreds of people from the ages of 19 to 29 died from illicit drug poisoning last year. Youth service providers say there isn't one solution to keep young people from overdosing, but giving them options that are available where they live is part of the answer.
So complex care housing is needed in a way for youth and how we'll stop overdose deaths, because they would have access to have like one-on-one support workers and stuff like that, not just having no one there for you. Like a lot of supportive housing that is out there now, it's like you're independent pretty much.
Complex care housing combines where people live with health and social supports. Peer support worker Cully Sudgemore says having youth-specific overdose prevention sites available at this kind of housing would help.
Well, then a lot of buildings still don't have OPS sites like they should, but for youth funds, I know it would be more complicated and stuff, but it would actually probably save lives because they're not using alone in their own room and stuff. They can actually go somewhere to use and be safe and use.
There are no youth-specific overdose prevention sites in Vancouver. And we know that's a problem, and we want to be a part of the conversation to make that possible in the city.
Chelsea Minhas with Covenant House says there needs to be safe places for young drug users who aren't ready to stop their substance use. Drug use is not allowed on site at Covenant House in Vancouver, a major youth housing provider. The Canadian Observatory on Homelessness says that's because their housing programs are based on abstinence. Right now they offer drug testing and harm reduction kits, but they're working on a new expansion.
That in the next couple of months we'll be opening our Sanctuary program. And the Sanctuary program is a low barrier shelter program for youth ages 16 to 24. That's going to allow us to engage with a population of young people that we historically have not been able to do the job we would like to.
At Directions Youth Services, staff are already doing that.
We have one very low barrier shelter program called Haven, and it was set up and intended to be a support for young people who have substance use and mental health challenges. And one of the fundamental principles in that program is to acknowledge and support people even where they are engaging in substance use.
The province announced a new complex care housing program in January. It says the approach will address the needs of people with overlapping mental health challenges, substance use issues, and acquired brain injuries. The first 4 housing sites will be in Surrey, Abbotsford, and here in Vancouver, which will have 2 of those sites.
All of our substance use services across an entire continuum, from detox to treatment to the distribution of harm reduction supplies to safe using sites, ought to be considering the unique and specific needs of young people.
In Vancouver, Kier Junos, City News.